Hey, welcome everybody to the Wednesday night Fun Saver Network Wellness Wednesday. We do this every 2 weeks, and what we do is we invite our vendor, our fantastic vendor, Daniel and Keisha, to come on here. And what they do is they come on and they tell you about these health and wellness products that they have, and they're totally different than anything you've ever seen before. For me, they are anyway, and I'm sure they are for some of you as well. Some of you are using these products and you're loving them. I know I am. So, what I like about this is, we're not going to get on here as far as Fun Saver Network, me or Shane or Shelly or Bob, and try to explain these to you because we're not the experts in this field. This gentleman I'm about to introduce you to would be the expert in this field, and it's only the right thing to do as a member of Fun Saver Network to get the information from the correct person. That would be Daniel and his lovely wife, Keisha. So tonight, I have the great pleasure and honor to introduce this young man. Look how young he looks. Look at the screen, y'all. Look how young that man is. This man named Daniel Lyons out of California. And I think I'm on the correct path to say they are going to be talking tonight about a product they were talking about 2 weeks ago that they were bringing back on board, one of them. And I think one of them is new. I could be incorrect. I'm not sure. But let me turn this over to the expert because, as I stated, I'm not the expert. I just used them. Mr. Daniel Lyons, can you hear me?
I can hear you great. Thank you, Ron. Thank you very much.
Fantastic. You have the floor, sir. It is all yours.
Well, thank you. Thank you as always. We're here in California. We've been through a tremendous ordeal for many friends and family members and things, but we're blessed that
Are you guys okay?
yes, we are all fine. My family. I do have a tremendous amount of friends that have been affected. Homes have been lost, and people have been moved, and it's a tragic thing. But we're all good. My family's good, and thank you. And we're here live from California.
Fantastic.
trying not
Fantastic.
to trying not to fizzle out too much. But anyway, thank you for listening to me tonight and to talk again about NutriRelief, which is the name of the company. And many of you might be familiar, but just to recap for those, I really am always trying to make the focus of why NutriRelief. And if you're new to the Fun Saver Network, it is an awesome network. We love it as being able to contribute to the Fun Saver Network, to Ron and Shane, Bob bringing us on board. We've got a long history of producing our topical liposomal creams. And the question I'd be asking if I was new to this would be, so what? What is so different about your creams? What is NutriRelief all about? And why are we even here tonight talking about it? It's Wellness Wednesday, which means I want to talk to you about what's so unique and different about NutriRelief. And we have been making this formulations of topical cream since 2009. And what's so unique about them is that they're liposomal topical creams. When you hear the word liposomal, you may be going, so what does that mean? It's a synonymous word with transdermal. We use the skin as the point of administration for supplementation. So we're all used to taking all of these supplements, and we've been looking at the supplemental industry for years. And I'm sure many of you are supplementing, trying to have the healthiest life that you can have. Well, what's been wonderful for me is I personally am metabolic challenged. I mean, I have a hard time with absorbing and digesting food, but then also getting the nutrition from my food. And specifically for that, many people suffer from that in the terms of, am I really getting nutritional benefits from supplements? And so we went out of our way with a number of my scientific board doctors that we deal with in terms of our line, which has now become a clinical line in that I service many doctors, practitioners, naturopaths, functional medicine doctors with our line. But we formulate all supplementation through the skin, and it's so beneficial because the absorption capability of this liposomal technology, which we have registered, trademarked, through the patent attorneys of California is we have a liposomal delivery technology. It's called LDT. It's a very interesting technology. But kind of curiosity is I would love to show you a picture of it, but I have a little example here. It's kind of like a liposome is, for those who don't know, it's like a spherical ball made out of phospholipid. It's microscopic, but allows us to blend this microscopic liposome, which is derived from lecithin from sunflower. So it's a natural plant extraction, but our bodies actually make liposomes or phospholipids. Each cell of our body, here's a cell, for example, a cell, a blood cell or a skin cell. This is example of a phospholipid that surrounds every one of our cells, blood cells, every one of skin cells. But when you open this up, this allows the opportunity for us to introduce bioactives to the center of this liposome. And so what's the beauty of this microscopic liposome is that we can put bioactives, B12, glutathione, vitamin, minerals, and amino acids inside of this phospholipid shell that basically utilizing the skin in the cream formulation, and it metabolizes on contact as it penetrates through the skin, delivering a payload of bioactives directly into the circulatory system by passing through the skin into the blood vessels and entering into the circulatory system. So it's a very efficient, effective way. And what's beautiful about it is a little bit of it goes a long way. And so that is basically the nature of NutriRelief. Our whole line consists of these liposomal topical creams, which assist in total supplementation for antioxidants, for B vitamins or vitamins in general, detoxification, sleep, pain, neuropathy, all of the afflictions that you have of most diseases, we pretty much cover in a way that we can offer antioxidants, detoxification agents, vitamins, and minerals for your health and wellness. So in a short term, in a short amount of time, that is what we do. And what's beautiful about the Fund Saver Network is they are carrying almost our entire line of these topical creams, supplemental creams for you. What we have recently been out of, as we just joined, was two creams that I want to talk a little bit about tonight, which are so beneficial. We can talk also at the end, we'll take questions of those of you that have questions, but we can recap on any of these creams. But the objective of our Wellness Wednesday is to, one, introduce a new cream or talk about a cream that many of you may say, what is that for? How do I use it? What do we do with this? Or I've got issues with neuropathy, blood flow, heart health, sleep, pain, and we can address all these issues in terms of which cream might be more beneficial for you. So within that context, I hope you understand a little bit about that. And any confusion, please ask questions. But what's been missing has been the first cream I want to introduce tonight is our NutriFlow Max, which is just really one of the first creams I've created, and it's one of our best sellers. And I know Cheryl, for example, this is one of the creams that she loves, and we've utilized this so much. And this is really I'll call it a banger. You know, it really is one of our key creams because of its vascular health. One of the biggest, all causes of mortality in our life is going to be heart attacks and heart health for women and for men, and especially women. And one of the issues with this cream, NutriFlow Max, is it creates and is a precursor to nitric oxide. And it's really important as we age, and it really is typical of the aging process. After the age of 25 and 30, we just become deficient in vitamin, minerals, and amino acids that our body is producing. This is a result of poor supplementation or poor food choices or just the food supply in general. That is just not your mama's or grandmother's broccoli anymore. We're monocultures in terms of how we create fruits and vegetables. And then it becomes the other issue, like myself, that so many people suffer from, is what are you absorbing? And one of the analogies we like to say is you are what you absorb. But if you're taking, mega doses of vitamin C or glutathione or any supplementation through your gut, so many people suffer from inflammation of the gut. This inflammatory response of the gut and the responsibility of the liver to digest all of this processed food is what's really become catastrophic for the supplementation industry, because you're taking mega doses, thousands of milligrams, and how much of a percentage are you absorbing? And typically in the average individual through the gut, you're getting, maybe if you're lucky, 100 milligrams of vitamin C. You might be absorbing only 25 or 20% of supplementation. If you have inflammation, maybe none. And in this case, that's what I want to talk about in another one of my creams tonight, which is the B12. Beautiful cream for supplementation, which is very difficult to absorb through an inflammatory response of the gut. But in NutriFlow Max, I'll talk about the composition of it. What's unique is we are a functional cream company, meaning our creams do something. We add the ingredients, whether they're amino acid, vitamin, or minerals, and that's it. We don't add any drugs. We keep it very basic to the functions of cell growth. What are the fundamentals of growing new cells in our body and having a healthy body is mitochondrial function of the bodies. And we really want to talk about what happens in life as we become deficient. After 25 and 30 years old, as we age, we stop producing nitric oxide. We stop producing the ability to have melatonin, for example. We have harder time sleeping. We have stress in our lives. And all of these factors are really becoming part of the problems of disease. When you are deficient in any vitamin, mineral, or amino acid, it allows the opportunity for our immune systems to be compromised. So it's really important during these winter periods that we come into is boosting our immune systems. And in the process of boosting your immune system, it's about absorption and being able to get good sources of vitamin, minerals, nutrients, phytonutrients, and everything from your supplemental practice. So what's the point of taking supplements if you can't absorb them? So you are what you absorb. And using the skin as a point of administration for us has been so beneficial. And for so many of the folks that have utilized them in a number of the platforms we've been on before, but I'm hopeful in the Fun Saver Network that people are enjoying them. And I always love to hear from them. And many people have. We've been talking to so many of you in terms of how we've been able to help you. But in the NutriFlow Max, the composition of this, which is so interesting, is it's based, the first two ingredients on it are two amino acids, which are L-arginine and L-citrulline. These are two amino acids that essentially are vasodilators. They were discovered and got a Nobel Prize in medicine for the discovery that these two amino acids generated nitric oxide. And this was a number of years, a decade ago, that they were discovered or more. And in the process, many things are derived from them as vasodilators, which means they open the blood vessels. They expand and open the blood vessels and generate a gas, nitric oxide. This nitric oxide gas is so essential for vascular health, for our arteries, for our heart, for circulating our body, for all of our organs, in that this nitric oxide in the blood supply is increased. This Nobel Prize that was awarded to them ended up becoming a derivative of many things. As a vasodilator, L-arginine L-citrulline became the precursor to Viagra. They decided after that that they could utilize this technology of L-arginine, and it became the analog by which they created Viagra, which also is part of what NutriFlow can be. It's many things in what it does as a vasodilator, but in the case of, say, sexual function, many of the commercials you see, is it a function of low testosterone or is it blood flow? In this case, your answer is blood flow is solved. We can increase with this product, help with neuropathy and creating all that blood flow into our vascular system for your legs, for your feet, but specifically for your heart. And we can talk a little bit about that function as I continue with the next ingredient that's in it. So the NutriFlow Max, besides having the nitric oxide boost, and that's the other name that we call a nitric oxide boost, also has niacinamide inside of it, which is such a beneficial product for anti-inflammatory. It's a B vitamin, but it also has zinc sulfate in it. But in this process of the nitric oxide boost for it, it is so beneficial in all of the forms that it does for heart health. The function that it does, just a little technical here, is that when nitric oxide is released into your cardiovascular system, it comes through this endothelial sheath, which is in every artery, every capillary. It's a micron thick sheath that is on the interior of a blood vessel. And when the nitric oxide comes through in the form of vasodilation, it creates a pliability in our blood vessels. And this is the whole story that we all fall into as we age, is hardening of the arteries. That whole point of what is that all about? And that's basically because as we get older, lack of nitric oxide, our arteries starting to stiffen, and that's where the plaque will grow and settle and conglomerate. And the whole point of nitric oxide is to keep this flow of your arteries so nothing is sticking into the wall, or the reduction like a sewer pipe, in that so much cholesterol and essentially calcification in our arteries is making the blood flow less and less. So high blood pressure is a result of that. So this NutriFlow Max would be utilized for anybody that's suffering from any form of high blood pressure or neuropathy or restriction in blood flow to their entire body. But it serves so many functions that way, and that, like I say, it's fabulous for sexual function for men and women, but also for heart health, vascular health, and in the form of neuropathy too. It's fabulous. Diabetic neuropathy is so restricting for people in their mobility in their feet. And by utilizing nitric oxide, you can restrict the progress of neuropathy, I mean, literally in its tracks, specifically in forms of advanced neuropathy, where you start to have the lack of sensation in your feet and obviously nerve damage. By bringing expanded flow, opening up those arteries down to your feet in the case of application, you get that return of blood back to the lungs and the heart to refresh and reoxygenate, and literally can reverse these scenarios and get back that blood flow and the mobility into those areas. The other thing that's so wonderful about topical creams in terms of their application is its targeted nutrition. Meaning, so if you're specifically talking about, for example, neuropathy in the feet or the extremities for arthritic condition too, it's very wonderful for arthritic condition too in bringing blood flow and anti-inflammation in those. But you can target these areas. So you can apply the NutriFlow specifically to the feet, neuropathy, to the legs, to any area that you want to have circulation. It's extremely beneficial for wound healing. You can imagine if you had surgery of any type and you're basically healing, the skin is healing, the body's healing in terms of the surgical procedure. Around the area, you can apply it, not in an opened wound, but as a wound is healing, it accelerates wound healing by bringing additional blood flow, and that's clearing out inflammation in any area of your body, but specifically saying a wound, a hip replacement, a knee replacement, shoulder surgery, any surgery in this body that you've got now circulating nitric oxide, you've got increased blood flow, reduction of inflammation, red blood cells coming into the area, and helping with the healing, accelerated healing. So it's really an intriguing cream, very beneficial, and simple in its ingredients. And that's really what our products are all about: functional medicine. They have a function, they have ingredients that are purposeful, they work in conjunction, they're cofactors, and they work together to accelerate the function of what they do. In this case, blood flow, heart health, to prevent heart health, to prevent heart disease from expanding and moving forward. And it's really beneficial, specifically blood pressure. If you were somebody that was in the situation, and this is another part of our big business. Most of the people, 50% of the folks that we deal with, are trying to get off of medications, not knocking medications, but a lot of people with BP, blood pressure medication, or statins, the side effect of these are overwhelming sometimes for folks. So a lot of the times we have people that are trying to say, I just want off my medications. What are the alternatives that you have that naturally I can assist with? And in this case, blood pressure medications, statins, these are very effective in achieving blood pressure reduction, lowering cholesterol, and overall heart health, and countering hardening of the arteries in that case. So that's kind of a generality. So sexual wellness, vascular wellness, heart health, and also in wound healing too. So very, very beneficial. Any questions about that? We can talk a little bit more about that.
So mainly
Yeah.
that, is it promotes blood flow. That's the bottom line for that.
Yeah. It's
Yeah.
really a killer for that. It is a blood pressure, really neuropathy. If you got neuropathy from diabetes or any restriction, but heart health, you're thinking heart health, this is the number one cream to start with. Just a
Mhm.
segue into the other cream that many of you are already aware of is the Trauma Max as a pain relief product. It has L-arginine in it too for blood flow, but it has the natural pain relief of arnica and boswellia. Very similar formulation with pain relief, natural pain relievers of arnica and boswellia. But it also is a heart health product, but specifically for arthritic condition of pain. And I want alleviation from pain with blood flow, vascular dilation, more blood flow, anti-inflammatory, and pain relief at the same time. That's the Trauma Max product, which we talked about multiple times. Many people have been using. But the NutriFlow is the number one cream that I have in terms of benefits for just straight blood flow and sexual function in that case.
So when you compare the two together, the Trauma Max and what you have in your hand, would you say that the one in your hand promotes more blood flow than the Nutramax?
No, they have similar amount of
Okay.
nitric oxide benefits in them. It just happens in when I created the creams originally, it's just so interesting to see what are the effects of making nitric oxide. Another benefit that this cream has would be for women for facial malaise, for inconsistencies. This is a dermatological or cosmeceutical. All of our creams are really made with emollients, and the only ingredients that are in them are binding ingredients to keep the creams in a cream form. When I first started making creams, it was always that idea of, how do you keep a cream? Shaking a cream to blend all the ingredients. These are stabilized and stay blended by just the emollients and beautiful emollients that are in them, and also natural preservatives in them. But it's actually a cosmeceutical cream. A lot of the times, women that have circles under their eyes or inconsistencies in their face, of skin tones, they call it the pregnancy mask or Malaysia or circums like that. By using the melatonin as a cosmeceutical cream, which you can very easily, it evens out the blood. It increases blood flow. And a lot of times, the circles under our eyes, the under eyes is where the thinnest part of one of the thinnest areas of skin on our body, and all that is just pooling of the blood. So the lack of circulation in your face, by just maybe dabbing a little bit of the um, NutriFlow Max, you can actually increase and eliminate circles under your eyes and even out skin tone. Women love this, and men too. I mean, I've used it as a moisturizing day cream also. So just another benefit to the cream. But yes, blood flow, circulation, key.
So one last question for me, and I know everybody else has questions. We'll get them to the end, but we're going to go to the next thing. But one last question. Since it promotes blood flow, is it safe to say it's an advantageous cream for autoimmune disease?
Yeah, I mean, we have other specific creams that I think would be targeted towards autoimmune. I mean, specifically would be D3 in that case. I mean, I can talk all about autoimmune. But yeah, I mean, you're boosting your immune. I mean, the whole point of my line of creams And the key is by getting supplementation that's effective, especially during this time, is bolstering your immune system. And your immune system is a consistent of one, blood flow, oxygenation, red blood cells being created, and having the mineral and amino acid content in your body to replicate new blood cells in a fashion that is very holistic and healthy. So blood flow is the key to health, heart health. And it's the key to reducing inflammation. I mean, that's the inflammatory response. When you've got pain, when you've got an injury, sports injury, or any kind of injury whatsoever, catastrophic or sports related, the first thing you're going to feel the pain from is inflammation or damage to tissue. And the key is by bringing blood flow, opening up the vascular, expanding the blood vessels, are going to bring more healing anti-inflammatory response. And in turn, that is an autoimmune, that is a function of prohibiting autoimmune from doing what it does. That's another thing about my issue with the gut health is, in the studies, a lot of what my business is has been research studies. And I love to, once we throw all these creams, then it would be great to really come to on these Wellness Wednesday and talk to you about, new studies, so many different studies that I'm involved in. I like to talk about, hey, just this study, and be able to put it up and show you guys, there's a new study that just came out, and this is what it's talking about in terms of, say, heart health, vascularization, diabetes. All of these things are so interesting and relevant to specific supplementation that addresses these issues and can change the trajectory of an autoimmune response, especially typically in the digestive process. When you have inflammation of the gut, typically the response coming through from inefficiencies in digestion are skin disease, ideas of psoriasis and rosacea, and all of these different skin are effects of inability to properly digest your food, leaky gut syndrome, irritable bowel syndrome, Crohn's disease. All of these are generally related to inflammation of the gut. And then the major player in that is the liver. The liver is basically trying to digest these incredibly unique processed foods that it just, I mean, I always kind of laugh thinking, if the liver could talk, what would it say? I think it'd be screaming. It'd just basically be saying, what are you guys up to here? Because, it's just our food source is just, it's so kind of unnatural in its process capabilities. The advent of increases in fatty liver disease. So children are getting fatty liver diseases at such an early age. And the axis point of inflammation of the gut is the ability for the liver to metabolize and digest the ingredients we're putting in to offer all of these instructions to the rest of the body. So that's where a lot of this autoimmune, they believe, is the generation is the gut, kind of like the second brain is the gut. So on that topic,
Okay.
if I can, I'll move on to the B12.
Let's go. I'm excited. Let's hear about the next one.
Yeah. So this one is the B12 vitamin, vitamin B12. And this is a B vitamin, but this is an essential B vitamin in the form that we use is methylcobalamin. And I don't know if people are a lot of aware, but there are a number of B vitamins, but this specific B vitamin is a hair, skin, and nails benefit, but it's also oxygenates the blood. That's exactly what it does. It does have the ability to pass through the blood-brain barrier, and it's very effective for recuperating from strokes and heart attacks. Because when you have restricted blood flow, once again, going back to the first cream, that is going to be what's generating a stroke or a heart attack or that health. And what happens when you have restricted blood flow or a heart attack? The lack of that getting to your brain is what could trigger the stroke that could, lead to other problems. But by having consistent amount of B12, you're oxygenating your blood. In fact, the nickname of B12 specifically that we call it is called windshield wiper for the brain. It's very interesting as I think a cognitive cream also for brain function, because I utilize it like tonight before I come on. or when I do my webinars. I'll put the B12 as it's proactive in that it creates thought by oxygenating the blood, by having in your bloodstream, you have brain function that is clarity. So it's like a windshield. So that morning fog, for example, that you wake up before you have your cup of coffee, if you supplemented with B12 in the early morning, you get kind of a very quick, instantaneously clarity of mind for starting your day, your projects moving forward. Not like caffeine where it's jittery or energetic in that way, but it's also really a beneficial cream for, say, ADHD or where lack over aggressiveness, but wanting to have that function of clarity. So attention deficit really gives you ability to focus. But the benefits of B3 are outstanding. I mean, I have my own cheat sheets here that I haven't even been paying attention to, but so many functions that it does, the B12. But I really like the idea of oxygenating the blood. Things like PCOS for women typically are very deficient in B12, and the methylcobalamin form of it is it's already methylated, meaning it's easily absorbable. A lot of the B vitamins, in the event of taking them orally, this whole MTHFR, this gene that basically is a problem for methylation, the ability to digest and methylate food. That's kind of what I suffer from, which is the metabolic syndrome. But this B12, because it's the form of methylcobalamin, it's a methylated form, so it makes it very absorbable. But that's this key about orally taking B12. If you have inflammation of the gut, the B12 orally is absorbed in the very lower intestines, in the villi. And if you've got inflammation in your gut at all, it just doesn't have the ability to be absorbed by the villi, which is in the lower intestine all the way down there. So say you're supplementing B12, and if you've got inflammation, it just is excreted and you're not absorbing it at all. So through the skin is really, really beneficial for B12 supplementation. In PCOS, for example, a lot of times obviously a lot of women suffer from PCOS. One of the symptomatic scenarios is anemia. And this is fabulous for those that are anemic. It increases red blood cells too, and can be very beneficial for energy. It's energetic in that form too. By increasing red blood cells, there's health in the blood stream, oxygenation of the blood, and I love the idea of the microcirculation. But like before I came on today, I'll take a little B12 on my wrist, but I'll also rub it on my temples, because it does cross the blood-brain barrier. And what I get is I'm getting a little bit of extra circulation for this old brain of mine to remember the words that I need to say on a webinar. So those are the circumstances of it all. And I appreciate, Ron talking about, thinking I'm the young man, but I am going to turn 70 this April. I was born in 55. So I've been involved in this planet for quite some time, but I get the benefits of the youthful look from these topical creams, the melatonin night cream, the Nutriflow Max as a day cream moisturizer. For me, it's creating such blood flow and almost new generating new skin, and reducing wrinkles with the benefits of the niacinamide, the B vitamin that's in. So with that, I mean, I could talk more about it, but unless there's something specific, I'd like to just keep it kind of in an open forum here in the top of the hour down to the bottom. Just say introduce two creams. I could probably go in deeper, but if someone's got a specific question about them or something symptomatic or something they're interested in.
The only question I have is, can I bathe in it?
Well, that's a great question. One of the things that's wonderful about these creams is we have almost a 10-to-1 ratio. When you use the gut for supplementation, this is the idea of what's happening. We've really been involved in the supplemental industry. I see it as mega dosing, 500 milligrams or 1,000 milligrams of supplemental form and the inability to absorb that. When you start getting into these natural practitioners and functional medicine, this is something that's evolving. Lower dosage is really the key. And if you really were to do, the key is in functional medicine and also in naturopaths, the key to the situation is when you get a blood, you're typically most people get an annual exam. Most people get a blood test annually. And if you look at if you take your blood tests or saliva tests or hormone, get in a level of hormones, minerals, and vitamins, they're there if you ask your doctor. But if you see that you're deficient in D3 or B vitamin or glutathione or any mineral vitamin, the key is to supplement to your deficiencies. I mean, if you've got a good D3 level, then you're boosting your immune system. But if you're deficient, boost just a small amount, not a mega dose. And so we're on a 10-to-1 ratio in these liposomal creams. I only have to use 1/10 because it is all bioactive. You get 99.9% of my bioactives through the liposomal technology through the skin into the bloodstream. There's no dilution with the hydrochloric acid, the biles, that whole experiment of digestion and the chemistry of the digestive acids affecting these supplements, and then the liver, metabolizing them. These are going into the skin cells and the capillary blood cells through diffusion, and these bioactors are getting in directly. So you can have a lower amount of the dosage, which they are, and our dosage is always based on 2 pumps of the product. It's a quarter measuring teaspoon. So a little bit like the B12 would be 250 micrograms of B12 in 2 squirts. That is a registered dose of what you would need on a daily basis to supplement with an essential amino acid. And because they're amino acid, vitamins, and minerals, there's no toxic level of these. So that's the beauty of using these. But it's just the idea of functional medicine these days, or naturopathic approach, is low and slow. And through the skin is a really beautiful way. And these topical creams are really delivering a payload. But also, in the last information on that, say taking a blood test, you see your deficiencies, and you could be utilizing a doctor and saying you're low D or low B12 or you're low iron or you're deficient. And then you can utilize with the creams that we have. And then 90 days, 100 days later, take another blood test. I assure you, your doctors would be going, hey, good work, nice supplementation. You're now at good standard levels. And that's the other aspect of these creams. The word is titrate up or titrate down. So if you've now got a nice balance of D3, you want to continue taking just a squirt or just a little bit to maintain those levels, those nice levels that your body wants for immune function, for heart health, to prohibit the diseases from overwhelming you, and especially during these times of the winter season where lack of sun, lack of getting that exposure, and just basically people and the diseases and of affluent of the flu because of a reduced immune system or a compromised immune system. So we're all about immunity here, and these functional creams are all about boosting that for heart health, blood health, immunity health, and that's the key.
That's fantastic. And I can tell you those tubes, folks, last a long time with just 2 squirts. They last a long time.
Yeah,
So
thanks for that. Thanks for that.
it's amazing.
Just the typical cream has anywhere from 200 to 220 pumps. Like the niacinamide, I was just checking it the other day, 220 pumps. So imagine if you're using just a couple pumps a day. I mean, these are typically
3 months.
month supply, month and a half supply if you're using them every single day.
Right, right. So Claudia asked, where is the best place to put the B12 cream?
Fantastic question. These creams are all wonderful that any place on your body can be effective. I mean, previously, I think with hormonal replacement therapy, progesterone, these kind of things, they were talking about the thinnest areas of your body. But what we found is that even areas where hair is, because of the follicle penetrating the skin, any area of your body, your feet, your face, your neck, your breasts, under your breast, your sternum. But this is the key. You can target locations that you specifically want. But typically, I'll use, like, for example, the melatonin cream. I'll use that on my face because it has anti-aging ingredients in it, but I want it for sleep, brain function. But the B12, I'll put on my wrists and I'll squirt it on my wrists. And, the key here on application of all of these creams are you can end up, I'm just getting off with a lady off the phone today who, really intrigued by the creams and buying multiple creams. And when you start with these creams, that's the key. They do so much function that you can use a lot of different ones for a lot of different reasons, but it's really great to start with a cream or see how the creams function. But you'll find that sometimes they function together very well. But in that case, it used to be, geez, I'm running out of places on my body to put these creams. But you literally can, if you're using a liposomal cream with a liposomal cream, my liposomals, they blend together. So in the palm of your hand, for example, if you wanted to put the Trauma Max together with the niacinamide 10%, because it's so beneficial, for example, arthritic condition and the benefits of creating new fibroblasts for like bone on bone situations, people like to combine these creams. You can blend two creams in your hand, blend them together, and then apply them in a location of a tennis elbow or a shoulder injury or a knee replacement or a hip replacement, and put them in any location. The application is simple. They absorb really quickly. That's the beauty of a liposome. This is not your, these are not your, like, just pat on my face or pat here. These creams have a beautiful function of applying them, and then just by rubbing them into your arm or just by the action of you're doing it within 20 seconds, you'll see they're gone. They literally just go. The liposomal technology just allows them to be metabolizing on skin contact. And for that reason, they're absorbed quickly. Going back to that original thing I talked about, every skin cell is surrounded by a phospholipid. My liposomal technology is a phospholipid. And inside that phospholipid are the B12, the glutathione, the nitric oxide, the amino acids. So when they hit another skin cell, skin cell hits our product coming in, it's absorbed immediately. It's like a friendly handshake. It's like a phospholipid that our body normally makes around a skin cell welcomes this cream to metabolize it, to say, oh, hey, come on into the body, nutrition through the skin cell into the capillaries, diffusion into the bloodstream, and they're now circulating and being effective in reducing inflammation, vasodilation, and reducing pain.
And that's awesome. And Gigi asked, does it help with skin tags?
Skin tags. That's an interesting thing. There's different kinds of skin tags that I've been familiarized myself with, and I have found that the melatonin has been very effective in reducing cancerous skin tags. For example, I have skin cancer. I have spent more time than anybody, I'm sure, in it. Spent years living in South America in my early years. I did pipeline construction in the jungle in my studies, anthropological studies at that time, and then went on to other things. But also I lived in Australia, New Zealand. I have skin cancer. In fact, I had Mohs surgery many years ago for that, and they had to eliminate that. But then upon using melatonin, when I returned after 8 years in New Zealand and Australia, and that's a whole nother story. I then got together with a number of doctors that we got onto creating Nutri-Relief, and at that time, and I had skin cancer. And my first cream that I developed was melatonin cream because the molecule of melatonin itself is a free radical scavenger. So I'm just addressing the situation that I had with skin tags or skin growths that happen. The first thing you notice when you have skin cancer is you'll get these little bumps, these little like growths that are on you that become become carcinomas. The melatonin just nails them. I would like to say I have skin cancer, but in utilizing the melatonin, I have halted all the skin cancer that I have. Now, I know for a fact if I just said, oh, well, hey, nice, I'm done taking melatonin, they will come roaring back. Okay.
Mm.
But it's a free radical scavenger in melatonin. The molecule itself looks for free radical scavengers in your bloodstream. So, in that event, now, dermatologically, skin tags, growths are things that can appear for a multitude of reasons. And a lot of times it could just be an autoimmune response or a dermatological response from infection and other things. But it's a really good question. But the first approach I would take for it is just dab a little melatonin. Like I have, for example, on the back of my neck here, what I would anticipate it's a cancerous growth. I'd anticipated it's something that was new. And I went out of my way to go, and when I put my melatonin on, I'm going over that a small eruption, and I'm putting the melatonin on it, and it just halting it, just halting it entirely. So I would approach, if I could say one thing about it, I could approach that melatonin as an opportunity for halting perhaps the beginning of a skin tag or addressing it. The other thing about just more information is usually they're the results of a skin reaction, okay? A disease, or once again, these autoimmune diseases are all, they're talking about the axis of these are leaky gut syndrome. So you're getting kind of compromised blood through undigested food and not very effective in the bloodstream passing through the gut. And when you've got this leaky gut syndrome, you're getting disease in your bloodstream. And these can be the causes of skin reactions, skin growth. So once again, it's an autoimmune response. Does that make sense what I'm saying?
Yes, it absolutely does. It absolutely does. So Clyde asks, what's best for cholesterol? Probably what you just showed tonight, right?
Yeah, lowering your cholesterol, BP, statin. This is awesome. This is an incredible product for that, for the function of nitric oxide as initial blood pressure regulation. The other cream I talked about last 2 weeks ago was introducing was the D3 with the MENQ7. Now, I'll tell you what, we go back to that. That is a new formulation. And the form of the MENQ, which is the K2, this is amazing. This fermented form of K vitamin, or in this case, MENQ, this is a fermented form that is a cofactor to the D3. So once again, this is the D3 cream with the MENQ7 or the K2 in the cream. When you take D3 or supplementing with D3, you release free-form calcium into your bloodstream. And the problem of not taking a K vitamin with that is you direct the K vitamin, directs that free-form calcium to the bone matrix, stronger bones. If you do not, you then have this calcium, free-form calcium, is now loose to get into a calcification action in your aorta, in your heart valve, in your arteries. This K2, this MENQ7, I'm telling you, 22 human clinical studies that talk about how it just will almost, it will just stop that calcification of the arteries of the cholesterol and calcification from calcium and of your food choices from being and connecting or restricting blood flow. So that is one of the key creams I would put together with the NutriFlow Max and just maintaining immune function, the D3 with the K2 for lowering cholesterol. So
that's fantastic. Paul asks, as a heart patient and a pacemaker defibrillator, are there any drawbacks from the use of these creams that I should worry about?
Yeah, and so it's interesting that is one of where you always want to be precautionary. You always want to consult your doctors. I'm actually very fortunate in a number of the doctors are getting educated. I mean, Western doctors still are, they're into prescription. But a lot of times they'll say to for defib patients and or for folks with pacemakers on there, don't do K2, or they'll put you on a Coumadin, a blood thinner. So don't have something like nitric oxide. Don't increase your nitric oxide. So
Mhm.
it's, I just got to say one thing. I've got a very, very wonderful um, neighbor who has, this same situation. He goes, I can't do K2. I can't do K2 of any kind. And it's interesting. This is a really important vitamin for heart health. And because they're on Coumadin, which is the blood thinner, they say do not do K vitamin because it's the clotting agent. K1 is a clotting agent. And they don't want to have blood clots. They want it so it won't create a stroke in that case, but it's kind of counterintuitive. I'm not challenging, but it's the point of I want to basically have good blood flow, but if I've got high blood pressure, I don't want to take a statin drug to restrict cholesterol. And
Mhm.
it's just that's a comment I'm making. So check with your doctor. This is very low dose and it's very effective for blood pressure and cholesterol reduction. The other thing about that's coming out with this Ozempic, right?
Mhm.
Loving it. People are beautiful. They want it. But as a mono treatment, say everyone get on it to lose weight, it's destructive for muscle tissue, especially older folks like us. Man, you'll thin down, your face will, it's the Ozempic face everybody's talking about. But you want to be working with strength building. You want to be building muscle. It will destroy the muscle we've been building all of our lives. And it's very hard, Ron, I'm sure you know, building new muscle as we get older. We want to
Yeah.
keep the strength building up. But, if you completely eliminate the cholesterol, that is what these antagonists are basically doing. They are restricting your ability to even absorb cholesterol. But guess where all your hormones are made from? Cholesterol. So
Mhm.
think about women later, not having hormonal function or imbalance of your hormones. There can have effects from them. So they're beneficial, but you got to keep exercising. You got to completely have supplementation. But I would be careful with blood pressure. I say it with a caveat. The benefits of heart health in taking a D3 with the MENQ7 are overwhelming. But the MENQ7 is not a clotting K2. It's a anti-calcification, really heart worthy. So if a doctor were to challenge this, I would say just look into MENQ7, the 22 clinical studies, take a look at the heart health, the functions that are happening there. But typically, when you get a defib or a pacemaker, they're going to put you on a pharmaceutical that's going to restrict um, blood flow. And
Mhm.
that's kind of the issue of, okay, one for the other. It's a trade off. So, I mean, we can
And
talk a
folks,
lot about that too. So,
I believe if I heard correct, I think Daniel just called me old, and I'm okay with it.
well, we're all getting there, we're getting there.
Yeah,
I
I
mean,
know. I
we
know.
want to we all want to grow old gracefully, but I,
Exactly.
I think the key
Exactly.
is supplementation from understanding how to give the body the optimal needs. And
Mhm.
you know, you're taking these multivitamins and you're taking all of these thousands of ingredients on these supplements, but really, if you were to look at blood tests and this is the simplicity, I would say, if you're deficient in blood flow or cholesterol or over cholesterol or that, look at where the specific areas the doctor what was telling you he wants to do and supplement just to those deficiencies. Let the body heal itself. And that's really the nature of our creams: vitamin, mineral, amino acids. Make sure you've got that going forward with beautiful phytonutrients in the food you do ingest, and let the body heal itself.
Exactly. So we have three more. I want to get through them. Let's see. Maureen asked, "Do you know if melatonin can have the opposite effect on someone?
Opposite in terms of
I
uh,
guess keeping you awake, maybe."
giving sleep. Um, Let me chime in entirely. There are some folks, I myself have really hard time with oral melatonin. It did nothing for me. I don't do well with opioids or like when I had an operation, for example, a hand surgery a while ago, I put my hand through some glass. A doctor wanted to give me morphine. Man, I can't. That just makes me delirious. Um, Melatonin didn't actually give me to sleep. It made me delirious. Where the melatonin through the skin is that beautiful deep sleep, REM sleep that takes you there, and it regulates circadian rhythm. So its function is that. Too much can do a number of things. That's why just a little bit of the melatonin. Now, our melatonin is interesting. Many people will go, "Oh my God, one squirt. It was so strong." Other person will go, "I took 3 pumps. It didn't do anything for me." Then they increased it by 1 pump. They took 4 pumps. And all of a sudden, it was like the perfect level of melatonin they have. Melatonin is another one of those things that as we get older, we stop producing it through the pineal gland in the middle of our brain. It's another story we can talk about. The melatonin is produced by complete darkness when our eyes are closed. So in darkness, it's produced. With eye opened, the melatonin is not produced in our body. We can get melatonin through other sources, but in the sleep application, what was I know maybe 2 people that I know are allergic to melatonin in a topical application. And they're usually because they have a autoimmune, when you have autoimmune, a antioxidant is like putting gasoline on the fire. So, but we can take another approach for autoimmune diseases with the skin.
All I know is this, Daniel. For
Yeah.
2 months religiously, I've been using the melatonin and I've been putting it on the back of my hand
Oh, wow.
every single night. And I
Excellent.
can tell you when I first started at 63, this skin was getting thin. It was getting kind of wrinkly.
Yeah.
It's not anymore. It's
You
not
know?
at all.
Wow. That looks like a
It's got
baby's.
some thickness to it and it's smooth.
Wow. Is that your bowling hand there? Are you
No, that
left-handed?
would be this one. That's this one. But there's one more here. Would the NutriFlow Max work for varicose veins?
Yeah, it can. It's interesting. It can. It can diminish that by increasing blood flow. And there's an interesting point of the spider veins. It's very effective for, but when the varicose veins get to the point of where they're bulging and they're basically, the ugly ones that you can see, you can feel them specifically. But for example, I had spider veins all over my face, but varicose veins are another thing. I try it. I do know women that have been very successful for it because what's happened with varicose veins is you've got trapped blood in these areas.
Mhm.
Now, if I could explain something about varicose veins, what's kind of interesting, rather than surgery on them, the whole point of the nitric oxide is it increases the valves in all of our blood. Every time your heart pumps and it sends blood through your whole system, all of the valves, all of our vessels are connected with valves. And the endothelial sheath is what controls those valves opening and closing with every heartbeat. The valves open and close. But when you get hardening of the arteries, these become restricted and they don't open and close. And so closing vessels off from free flow, you're getting blood trapped in behind the leg or on the calf muscles. And then what you've got is kind of almost a restricted blood vessel, and that's what's bulging. It can be from many, many causes, but if you were to work on blood flow and have endothelial vascular health, you could eliminate and keep, so you could get blood flow going through those areas. It's worth a try. Definitely for spider veins. I had spider veins in my face and I've eliminated them all through blood flow. And that was through too much sun exposure, wind, and sun, thinning of my skin. And these thickening the skin, the melatonin does too.
So last one from Sandy, because we're straight up top of the hour. Let me make sure I pronounce this correctly. Is there a difference between magnesium nitrate and magnesium gluconate?
Well, we supply magnesium citrate. Now there are multiple forms of magnesium. All of them do specific functions. Magnesium glycinate, this is just my business. I've I have another formulation that I've done for hormone replacement therapy doctors. I have my line is a clinical line, but I also on the side work with clinicians and doctors and practitioners and in hormone therapy because we have progesterone creams and I created a DHEA pregnenolone cream with magnesium glycinate, specifically the glycinate for a little bit of brain function. But in my business and through all the doctors that I've been working with, magnesium citrate or citrate, the form that we use, is the most absorbable and the least problematic in loose stools. So like magnesium oxide, for example, that's your base, that's the one you'll see that you put in your bath salts. Very effective for muscle relaxation, as is magnesium citrate, but it also is a base form that will, if you use it orally, you could really easily get the runs. And that is too much magnesium. You'll get loose stools. The glycinate is an effective form, less magnesium. But in my opinion, I ask people, as long as you're getting some form of magnesium, so beneficial. Any form, oral form, topical form. But you'll know you're taking too much, loose stools. But any form of magnesium controls over 400 enzymatic functions of the body. And we're all very deficient in magnesium. So supplementing with magnesium is awesome. Now, when you said magnesium, I don't know if you're talking about my magnesium citrate, but I don't know of a magnesium nitrate. That's something, maybe that was your pronunciation, but magnesium glycinate, magnesium citrate, magnesium thornate. There's so many different forms. Take magnesium. It is one of the most beneficial minerals and, not easy to necessarily absorb through the digestive tract. So it's really, really one of my best sellers for so many functions of the body. And remember, a lot of pharmaceuticals, specifically blood pressure medications, statins, rob the body of magnesium. And then it's going to be deterioration of the bone matrix by taking that away.
Okay, so what we have, Daniel, we have two hands up.
Yeah.
So everybody knows I'm going to take these two people with their hands up, and then we're done.
Okay.
Just so everybody
And I'll
knows.
try to make it quick.
So let's see. Cheryl, you can unmute.
Hey, Cheryl.
Cheryl Bailey, you can unmute.
Hey, Cheryl. Cheryl.
Blood Saver Networks loves Cheryl's because I notice there's a few here usually every time I come on the call. So it's popular. I have a couple of questions for you, Daniel. I'm sorry, I'll try to make it really quick. I take a product called Vinia, and it's a polyphenol. And I have 7 stents, so I'm a little bit of a problem. So I want to know if I can use the NutriFlow Max also, and if so, where should I apply it?
Yeah. So once again, polyphenols is fabulous in that case. I would just always consult with your doctor. It's really easy just when you go, or you can ask that question. Could I use L-arginine L-citrulline as a vasodilator? Would that be beneficial for heart health? Your typical answer would be increasing nitric oxide, yes, and doing it that way. L-arginine L-citrulline is the pathway to nitric oxide. So that is going to be heart health all the way. Like I said, some doctors say, oh, increased blood flow, danger of, if you're mixing it with Coumadin and you cut yourself, you could bleed out because they believe you can't clot. You couldn't stop.
No, I know. I had a problem with I was on blood thinners, so I stopped them.
Exactly.
But I mean, he knows about it.
Yeah, but I would, once again, I really think it would be beneficial. I've found that, many, many years ago, doctors were like, I don't even want to hear about this. I'm hearing more and more that they're seeing the ingredients. They see what we're doing, mineral, vitamin, amino acids. They're looking at the formulations. They're going, this is beneficial. Nitric oxide, blood flow, anti-inflammatory. Yes, could be very beneficial as a functional product for you to use for blood flow and vascular dilation. Could be helpful.
Gotcha. Where would I apply it?
And you can apply, I mean, literally, it's the interesting thing is this is the beauty of your participation. When you take a cream and you apply it, you can target, like, for example, I use the glutathione, I apply it over my liver. I'm putting it in a location of where I want to put it for like detoxification on my liver. But on heart
Gotcha.
health, I would rub it, you're involved in healing oneself. I would rub it right over your heart, just over your breast and the area of your heart. And
Interesting.
you're now participating in functionally driving something to your heart that is so beneficial. It's interesting, but it's so wonderful when you participate rather than just, I wonder if I'm helping myself or not. But I would put it over your heart,
I
but you
know.
could put it on your wrist. You could put it on your carotid artery. Just the
Oh,
blood vessels itself is carrying it throughout your body.
Wow.
gotcha. Do you have a product for hooded eyes? Because I've noticed a loss of peripheral vision, and I don't really want to have my eyes done, but I would like something that would like tighten up that skin.
More
It's
blood flow.
Yeah, it's interesting. My sleepy eye. My wife has hooded eyes too, and she was just trying to tell somebody one of these days I'm going to get some eye work done. Darn my mother for giving me these hooded eyelids. Once again, that's a kind of it's a no. I mean, yes, I mean, blood flow is everything, but it's just an idea. I don't have an answer for that one. That
Okay.
has not been a hooded. Yeah, no. I tend to keep. The creams aren't the only cream that affects the eyes and hurts them would be the Trauma Max because of the arnica. It could be a little bit of like, oh, because it has peppermint in it. But most of my creams are very effective for around the face. And when I put my melatonin on, I get it all over. It doesn't really irritate my eyes. I don't have an answer for that
There
one.
you go.
Okay.
Okay.
Well, I just wanted to say one thing. No one, please do not take Ozempic. I ended up in the hospital. My endocrinologist put me on it, and I ended up in the hospital, and I had pancreatitis. So
Oh,
don't take it, guys.
Don't take it.
Very much,
All
Daniel.
right. Cheryl Church, unmute.
thank you, Cheryl. Thank you.
Thank you. I just wanted, well, what you were just talking about on the hooded eyes, I've been using all your products for 4 years now, and mine are about gone. So I don't know what's working, but something in all that stuff I've been using for 4 years is working because mine aren't so hooded anymore.
Oh my gosh. Once again, Cheryl, thank you for that. Cheryl is the person that, these creams, it's all of you that, we create these creams, we formulate them with a function in their mind, the studies that support why. But Cheryl herself was using the 10% niacinamide for another function, which knee function for anti-inflammatory. And Cheryl was the one that discovered it was the most amazing scar cream she had a childhood scar that never went away, and she was applying the niacinamide. And now we consider the niacinamide an extremely good scar cream for old scars or scars. And Cheryl tells the story. How's that scar doing, Cheryl?
It's just about gone. I can't even hardly see it anymore. And it was pink and purple and bumpy and looked real awful. And everybody would always ask me, what did you do to your leg? And I'd say, oh, I put about a 3-inch limb off a tree through it.
Yeah.
It was a major scar in 5th grade. And
Yeah.
you
And so now,
you
yeah,
and
and
me,
so
buddy, are birth year, people. So I just turned 69. So, after having that scar for all these years and it disappearing 3 years ago,
Yeah.
it was like, I was telling somebody the story and going to show them my scar and went to look down there and it was gone.
Yeah, yeah.
Where did my
Thank you
scar
so
go?
much. Thank you so much. We call that, we have another label on the 10% niacinamide for another division 21 again, and we call it skin repair. It's very good for psoriasis, for eczema. But now, to answer the question for Cheryl Bailey, it works for hooded eyelids.
For hooded eyes.
Whatever it uses. But anyway, what I got on here to tell you, Daniel, was the last time I went to the doctor, I had them check my magnesium and it came up 2.1, which is in the normal range.
Excellent.
And
Excellent.
that's what I wanted to come on here and tell you. But also, since I broke my kneecap, that was the Monday before Christmas. And 3 times a day, I've been mixing up in my hand Trauma Max, 10% niacinamide, and magnesium,
Excellent.
and rubbing it on this leg, on this knee. And I still never got a cast. I got a different knee brace on
Wow.
now. And here this week, I'm supposed to be able to loosen it up and get about 40% knee bend in my knee.
Excellent. No,
And
I appreciate
Carol,
that.
Carol, we're praying for you, but the more I hear you talk, the more I think you're an accident looking for a place to happen.
No, I'm not.
I'm just kidding with you. I'm just kidding with you.
Well, just don't leave batteries laying outside. But I actually saw those batteries out that door
I
that
hear you.
morning, and then I forgot,
Yeah.
went out there and tripped right over one and hit the concrete.
Mhm.
Kneecaps
So,
don't work real well in concrete.
we've been here a little over an hour. I don't ever like going over an hour, but we did. I enjoyed it. Hope you did too. So, one thing I want to tell everybody: no, it is not in our store yet. It is on the way. We just heard about this today, like you did. That it's out. It's ready to do. What I want to tell you is this, though: how many of you have joined a health and wellness company, and you go to their webinars, and all you hear is about testimonials? This happened, that happened, this changed. As you can very well see, for the people that's never been here before, Fun Saver Network is totally different. When is the last time you've been on a phone call like this with a part of a health and wellness company that you bring the expert on and you get the kind of information that you got this evening? Probably never. And I thank Daniel and Keisha for doing this every other Wednesday. I look forward to these because they're a lot of fun and they're informative, and I like to learn. So, Daniel, thank you very much. I
Welcome.
appreciate you, and I appreciate your wife, and I appreciate all of you here this evening. And don't forget, tomorrow we have another webinar. It's the Opportunity Webinar, 7 Central, 8 Eastern, same place. We are on Zoom. God bless everybody, and good night.
Good night.
Thank you.